Movember was born over a few beers between my brother and a mate, and why hadn't the moustache ever made a comeback, and that was the genesis of the idea. We had a couple of Mobros from Edmonton, a couple from Toronto and Vancouver as well, that had all experienced Movember somewhere or another. So in 2007, when I brought the campaign to Canada, we had 2,300 Mobros and Mo Sisters rise to the challenge in that very first year. Cut to 2011, we had 245,000 Mobros and Mo Sisters. It's been exponential year on year on year. Movember really has two primary outcomes. One of them is getting men engaged in their health and more importantly talking about their health. And by virtue of growing a moustache, each guy has 2,400 conversations. People are posting up on Facebook multiple times during the month. They're tweeting, they're writing about it, and that is having a dramatic impact on the level of awareness and engagement of men in their health. The Canadian campaign is now at a size where we're able to support two causes, and we're really proud in Movember 2012 to be adding a second cause, which is male mental health alongside prostate cancer.
It's about keeping men healthy, which is something the PCC is passionately committed to.
What are the gaps in knowledge? What's the reality of men's health? The life expectancy of the average male is about 4 or 5 years less than females. So we identified mental illness as being a very significant link to men's health in general. Mental health impacts 1 in 5 Canadians, and the other 4 either have a friend, a relative, a colleague, co-worker, or someone else that they know who is impacted in some way by mental illness. It affects everyone, it affects all of our communities.
We have men and their caregivers that deal with anxiety, depression, and various mental illness as a result of being diagnosed with the disease. And we also know that the risk for suicide in men with prostate cancer is over 4 times that of men without prostate cancer.
With Movember's help, we are forming the Canadian Male Health Network. And one of the first priorities of this network will be to advise Movember how to invest in mental health.
It really is a silent killer, and we want to bring the same level of attention and funding to that as we've done prostate cancer. The objective for Movember holistically is to create a healthier, happier and more productive community. And fundamental to Movember is collaboration, and what we're going to do is not fund one institution, but we're going to fund many institutions right across Canada. And what we've done is brought together an advisory group of the very best medical and research minds focused on men's health across Canada.
Movember has asked me to chair an advisory board to help them understand where the gaps are in mental health. An important task of the Canadian Male Health Network will be to connect the dots. The time is now for male health.
This is a true milestone for men's health in Canada. I just challenge everyone to join us, grow a moustache this Movember. To all the Mo Bros and Mo Sisters, thank you so much. Together, we are truly changing the face of men's health.